Imagine a world where vaccines no longer exist. Not because we've eradicated disease, but because people have simply stopped taking them. A world where children once again suffer from polio, where measles outbreaks sweep through schools, and where diseases once thought confined to history make a deadly comeback. This isn't the setting of a dystopian film or a speculative novel. It's a plausible future if the trend of vaccine hesitancy and outright rejection continues to grow unchecked. Vaccines have been one of humanity's greatest achievements, preventing millions of deaths each year. But what happens if people stop vaccinating? The consequences would be catastrophic, not only for individuals, but for entire communities, economies, and health systems. Vaccines have saved more lives than any other medical intervention in human history, apart from clean water. They have eradicated smallpox, nearly eliminated polio, and drastically reduced deaths from measles, diphtheria, tetanus, and whooping cough. Diseases that once decimated populations are now rare thanks to widespread immunization. Herd immunity, where a large portion of a community is immune to a disease, protects even those who cannot receive vaccines due to medical reasons. This collective shield has been critical in protecting the most vulnerable. But this safety net is fragile. It relies on high vaccination rates to remain effective. When people stop vaccinating, that shield begins to crumble. Diseases that have been held at bay begin to resurface. Measles is a prime example. Highly contagious, it requires about 95% of a population to be vaccinated to prevent outbreaks. In areas where vaccination rates have fallen below that threshold, outbreaks have occurred, even in countries where measles was declared eliminated. These outbreaks are not isolated incidents. They are warnings. They demonstrate how quickly a disease can return and spread when immunity levels drop. Polio is another threat. Though eradicated in most of the world, it still exists in pockets of countries like Pakistan and Afghanistan. If vaccination efforts cease, polio could reestablish itself globally, paralyzing children and adults alike. Diphtheria, once a leading cause of child mortality, could stage a comeback. Whooping cough, which already resurfaces periodically, would become a constant threat. Diseases that modern society views as relics of the past could become part of our future once more. But the danger is not limited to individual diseases. The collapse of vaccination programs would overwhelm health systems. Hospitals would be flooded with patients suffering from preventable illnesses. Intensive care units would reach capacity. Doctors and nurses would face impossible choices about who receives treatment. This strain on the healthcare system would compromise care for all patients, not just those with infectious diseases. People with cancer, heart disease, and other conditions could see delays in treatment. Maternal and child health would suffer. The ripple effects would be immense. Children would bear the brunt of the consequences. In countries with falling vaccination rates, infant and child mortality would rise sharply. Schools would become hotspots for outbreaks. Education would be disrupted as institutions are forced to close or quarantine students. Parents would live in fear of sending their children out into a world teeming with invisible threats. The progress made in global child health over the past decades would be reversed in mere years. Economies, too, would take a hit. Outbreaks reduce productivity, disrupt trade, and increase healthcare costs. Businesses lose employees to illness or caregiving. Travel restrictions are imposed. Quarantines become common. Insurance premiums rise. Government budgets are stretched thin, responding to emergencies. In a globalized world, an outbreak in one country can quickly spread to others, triggering a cascade of economic and political consequences. The COVID-19 pandemic offered a glimpse into this dynamic. Without vaccines, such disruptions would be more frequent and more severe. Social trust would erode. When people refuse vaccines, they are not just making a personal choice, they are endangering others. This creates tension between those who follow public health guidance and those who reject it. Communities fracture. Misinformation spreads like wildfire, amplified by social media and fueled by distrust in institutions. Conspiracy theories take root. Science is dismissed. Public health becomes politicized. The cooperative spirit necessary for managing shared threats is lost. In such a world, even basic disease control measures become contentious. The psychological toll cannot be understated. Fear of disease would dominate daily life. Parents would worry constantly about their children. Immunocompromised individuals would live in isolation. The simple act of going to a crowded place, school, a concert, a bus, would carry a heightened sense of danger. Anxiety, stress, and depression would rise. Society would become more cautious, less connected, more fragmented. The cost of this emotional and mental burden would be profound. So why are some people turning away from vaccines? The reasons are complex, and misinformation plays a central role. False claims linking vaccines to autism or other disorders have been thoroughly debunked, yet they persist. Social media algorithms often promote sensational or fear-based content, giving vaccine misinformation a wider audience. Some people mistrust pharmaceutical companies or government agencies, believing vaccines are driven by profit rather than public health. Others see vaccination as an infringement on personal freedom, framing mandates as tyranny rather than protection. Cultural and religious beliefs also influence vaccine acceptance. In some communities, traditional beliefs conflict with modern medicine. Language barriers, historical abuses by medical institutions, and lack of education compound the problem. In high-income countries, success in eradicating diseases has led to complacency. People forget what it was like when measles or polio were rampant. Without personal experience of these diseases, vaccines seem unnecessary or even dangerous. The very success of vaccination has paradoxically made its importance harder to appreciate. The global vaccine system is also marked by inequity. While some people in wealthy countries reject vaccines by choice, many in poorer nations lack access altogether. The disparity became clear during the COVID-19 pandemic, where vaccine hoarding by rich nations left billions without protection. If global efforts to promote vaccines focus solely on hesitancy and not accessibility, the underlying injustice will continue. A world where some refuse vaccines while others beg for them is not sustainable or moral. What can be done to prevent the scenario where people stop vaccinating altogether? Education is key. Public health campaigns must be clear, compassionate, and culturally sensitive. They must meet people where they are, online, in schools, in churches, in community centers. Healthcare providers must be trained not just to administer vaccines, but to engage in meaningful conversations about them. Trust must be rebuilt through transparency, consistency, and empathy. Governments must regulate misinformation while upholding free speech. Tech companies must be held accountable for what their platforms promote. Mandates can be effective, especially for school entry or healthcare workers. But they must be paired with support, such as paid time off to get vaccinated, mobile clinics, and outreach to underserved communities. Incentives rather than punishment often work better. At the same time, a legal framework must ensure that individual choices do not compromise public safety. The balance between rights and responsibilities must be continually evaluated and negotiated. Science must continue to innovate. Vaccines should be safer, more effective, and easier to administer. Single-dose vaccines, needle-free delivery, and thermostable formulations could increase uptake. Investing in vaccine research not only improves current programs but prepares us for future pandemics. mRNA technology, for example, has opened new possibilities for combating everything from flu to cancer. The promise of these advances must be communicated clearly to the public. The media has a crucial role to play. Sensational stories that exaggerate rare side effects can do real harm. Journalists must report responsibly, contextualizing risks and benefits. They must highlight stories of lives saved, not just complications. People are more persuaded by personal narratives than statistics. Real stories of vaccine-preventable tragedies or triumphs can resonate in ways data cannot. Parents must lead by example. The decision to vaccinate affects not just one child, but an entire community. By choosing vaccination, parents contribute to a safer environment for everyone. Schools can support this effort through curriculum, peer education, and health partnerships. Religious leaders, celebrities, and influencers can also use their platforms for good, dispelling myths and promoting facts. Global cooperation is essential. Diseases do not respect borders. Surveillance, funding, and rapid response systems must be strengthened. The World Health Organization and other bodies must be empowered and supported, not undermined. High-income countries must share vaccines and resources equitably. Vaccine nationalism is not only immoral, it is self-defeating. We must remember what's at stake. Before vaccines, smallpox killed over 300 million people in the 20th century alone. Polio paralyzed tens of thousands every year. Measles claimed over 2 million lives annually as recently as the 1980s. Tetanus, diphtheria, rubella, all of these diseases inflicted unimaginable suffering. Vaccines changed that. They didn't just save lives, they transformed them. They allowed children to grow up healthy, parents to stop grieving early deaths, and societies to flourish. To let that progress slip away would be a betrayal of generations who fought for it. If people stop vaccinating, the world will pay a heavy price, in lives lost, trust broken, and futures denied. But it doesn't have to be that way. We have the knowledge, the tools, and the power to protect ourselves and each other. We must use them wisely. The choice is ours. A future plagued by the return of preventable diseases, or a world that honors science, values community, and protects the health of all. If we stop vaccinating, the consequences will be swift and severe. But if we stand together, informed and compassionate, we can ensure that the story of vaccines remains one of humanity's greatest triumphs, not its tragic undoing.